Hi, I'm Bob Carr. At the Give Something Back Foundation, we focus on higher education and its transformative effect on young lives, especially for those who have faced adversity. And that's why we're proud to support the important educational programming produced by the Caucus Educational Corporation.
Funding for this edition of One-on-One with Steve Adubato has been provided by Choose New Jersey, Gary's Wine and Marketplace, creating an individual shopping experience for every guest. New Jersey Resources, MD Advantage, the Give Something Back Foundation, NJM, and by the New Jersey Office of the Insurance Fraud Prosecutor. Insurance fraud costs New Jersey families $1,300 a year. Promotional support provided by Jaffe Communications, where business, media, and government converge in New Jersey. And by hipnewjersey.com. Live hard, work hard, play hard. You're from New Jersey, and so are we.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
We are pleased to be joined by our good friend, Dr. Joe Marbach, who is the president of Georgian Court University. Good to see you, Doctor.
Great to see you again, Steve. It's been a while.
Yes, it has. For those who do not know what Georgian Court is, describe it.
Georgian Court is the Mercy University of New Jersey, and what that means is we were founded by the Sisters of Mercy 108 years ago, and we relocated to Lakewood, New Jersey in 1923, so we've been there for quite a while. And we're formerly all-women school,
right? And
we went co-ed 4 years ago. So we're a small to medium-sized gem in southern and central New Jersey.
Well, and Georgian Court has recently joined the public television family as a supporter, and thank you for supporting our efforts. But I just want to ask you this. You want to talk about student debt. We want to talk about student debt. Why is the student debt crisis as bad as it is, number one? Number two, more importantly, what can we do about it?
It's a very nuanced problem, and you really have to look at it as a whole and then break it down. There's a lot of students that have a large amount of debt, but then are they graduate students who are moving on to professional careers? That's where you see a large portion of debt. There's another segment of students, your typical undergraduate, who's incurred a lot of debt, often at the for-profit schools, and they're going through a lot of scrutiny these days. The federal government actually pulled the accreditation status of the major accreditor for many for-profits. And the other large problem you find are students who don't graduate. If a student doesn't get their bachelor's degree and they still incur debt, they just don't have the earning power to pay that debt off down the line. And so what we've taken pride in at Georgian Court is that while our students do incur debt, we're a private institution, so we have limited financial resources, they have a very low default rate. Our default rate is less than half what the national average is.
And why is that?
Well, because they're prepared for good jobs. They're able to go out and get those jobs, and then they can pay down their debt over, one estimate was in about 2.5 years.
But you've also argued, Joe, and you have a political science background, so you look at this from a public policy perspective as well. You've also argued that there's been a significant decrease in federal government aid to students, which has had a significant impact and exacerbated this problem.
That's also the case because what we've seen is Pell has been relatively stagnant. That's for students with the lowest income amounts. That's about $5,000 a year. So it doesn't go far when you have private institutions. Our tuition at Georgian Court's about $30,000 a year.
And make that clear. I'll stay on this. We'll come back to federal aid in a second. Decisions to raise tuition. Your policy.
Well, we didn't raise tuition this year. We held tuition flat, understanding the impact that even a 2% increase has on our current students and on students that are looking at us. We know that families are struggling, and the type of students that we've been attracting are students that need as much financial aid as they can get. We come in, we have about 45% of our students are Pell eligible. That means their income is less than the cost of tuition.
How do the economics work?
Well, it's very challenging. And we have some distribution of resources. We get some from our endowment. We have donors who have paid it forward or paid it back and provide scholarship funding, and we're using that. Other institutions are continuing to raise tuition because that's the way that they're looking to make ends meet. We have just tried to conserve our resources to be as efficient as possible in our operations so that we can hold the cost as much as we possibly can.
Let me ask you this. New Jersey-based colleges, for those of us who chose at the time to go to New Jersey-based institutions of higher learning for our undergraduate, graduate, doctoral work, whatever it is, and those who, and then our children, let's just say in most cases have more options. I'm curious about this. How competitive are New Jersey-based institutions of higher learning when young people are making the decision as to where to go to school? And are we competitive enough?
We are not. New Jersey's #1 export is 18-year-olds.
The brain drain?
The brain drain.
How bad is it, Joe?
We exported 30,000 students last year.
30,000 students left our state to go to institutions of higher learning outside the state.
Mostly New York, Pennsylvania, increasingly Maryland, but across the board, California, Texas. New Jersey has one of the strongest, if not the strongest, secondary school systems in the country.
So why are we losing them?
Well, they have multiple choices, and they're looking to go elsewhere. I think part of it is that we're a small state, and people want to go away. And as you said, our kids have options.
To some extent?
To some extent, I think. But on the flip side, we're not attracting students.
What could and should New Jersey-based institutions of higher learning do to, dare I use the word brand, attract, hey, here, this is a great place to be?
I think part of it is describing what our offerings are. Part of my challenge is to get the word out to families that might not have ever heard of Georgian Court.
So how much of your job, it's interesting, because the last interaction we had was you were at another institution of higher learning at Seton Hall as an academic, right? Political scientist, we're always talking politics. On Capitol Report, my colleague, Raphael P. Orman, great conversations. And I think to myself, Joe's now the president of this university. And I think how much of your job is as a leader, as a business person leading this effort, and not as an academic or chief academic officer? I know it's a loaded question. How much of it is about business?
Much more than I think I was ever prepared for.
A few seconds left, go ahead.
It really is about the bottom line and making things meet and being much more public, too. I'm the mayor of a small town in a lot of ways. I embody the Georgian Court values, the Mercy core values. So I'm also the spiritual leader on campus. I'm also the chief executive officer, so I've got to make sure the books balance. And we're doing that. Just came from a finance committee meeting, and they're always fun.
So you're always dealing with the numbers, the bottom line.
Bottom line, yeah. And part of it is to improve our numbers, improve recruitment, get us out into those markets in central and southern New Jersey.
And keeping academic standards as high as possible.
And they're high, yeah, and I have an advantage of that because of my academic background.
Dr. Joe Marbach, PhD, president of Georgian Court University. Thank you, Joe.
My pleasure, Steve.
Appreciate it. Stay with us. We'll be right back.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
Recently, my colleague Joanna Gagis visited a healthcare center in South Jersey to see how one approach to healthcare that treats patients like a client can actually improve outcomes and reduce healthcare costs.
We've all stood in line at the pharmacy, awkwardly whispering the prescription that we're there to pick up, hoping that no one around us can hear what we're saying. Well, checking out at a doctor's office can often feel the same way, but here in this practice, patients check out with a nurse right in the privacy of their own room. Here at Virtua Medford Medical Center, a patient's need for privacy was just one of several factors that led to the redesign of this healthcare center in South Jersey. Dr. Kapoor, tell me how you first had the idea to reform this medical center here in Medford.
It's been an evolution of concept. Right? We've been providing
medical care a certain way, a certain style for decades. But then you started thinking about concepts of form follows function, that you want to design spaces that support the work that's been done in our practices for a number of years. So then I was walking through the mall and I walked into an Apple store, right? And it's what a different experience. The moment you walk into an Apple store, you're greeted by a person who helps guide you in the right direction. You still have the ability to go walk through yourself, but you also have someone who's immediately there to help to guide you to the next step. So we say, if Apple can do it, why can't we in medicine try something along those lines?
Plenty of people walk into an Apple store and don't take that experience and turn it into something meaningful for themselves, for their practice, for their customers. What in healthcare has changed over the last few years that is kind of leading us to the path of saying, let's stop and analyze how we do things and figure out ways to do it better?
We're in such a unique place in healthcare right now, more so than ever before. Our patients are also consumers. And the right thing to do is to sit down and sit with our patients/consumers and understand what's going through their mind. Coming to the doctor's office is not a big deal for those of us who work here every day, but it can be anything but routine for those who are coming to see us. They're maybe coming in for something a little bit concerning, than an abnormal x-ray or an abnormal lab test, and then they need to sit down and talk about it. So again, how can we help design spaces that allow and foster those conversations in a comfortable area, in a safe environment, in a quiet environment?
In that spirit, guests who arrive here are greeted at the door and ushered to their destination, to the urgent care center, to their primary care physician's office, or to one of the specialty service offices.
When I came in, you get greeted by someone at the front desk. They check you in. They bring you to the back waiting area. When you walk in, it's very comfortable, relaxing. The atmosphere is very calm. There's a lot of space, a lot of privacy.
The primary care offices in particular have undergone changes that are meant to improve the doctor-patient experience. Each room has a conference table where the doctor sits and talks to the patient before the exam even starts.
This table makes you feel so personal and such a normal conversation you're having with the patient. I feel like it makes me listen to them more because we're sitting and talking to each other. It slows me down for a second so I can listen to them and not just jump in because they're on the table and start examining them, and I feel like I give better care because of that.
It makes it more personal, first of all, that's for sure. Traditionally, you're speaking to your doctor while you're up on the table and she's standing up, and now, you can actually sit down and have a conversation one-on-one at a table.
Problems with any of your meds?
If the patient consents, the doctor will bring in a scribe to take notes during the visit, allowing her more face-to-face engagement with the patient.
I've had people say to me that before the scribe that they felt like I was just looking at the computer and not looking at them because you have no choice.
What are you doing on that computer?
Well, you're documenting everything they're saying. If you don't document it at that time, you're not going to remember what they said. And you're thinking about all that while you're also trying to actually take care of the patient, which is really like the main thing you're there for.
So how are you able to better think and concentrate with the scribe?
I don't have to worry about the computer at all. I actually have a computer in front of me too, so I can use that time if I need to look at their test while I'm talking to them. I can think much more accurately when I'm not worrying about typing and documenting and navigating screens.
Perhaps the most significant change is the new structure of the office, with an open-air nurses station in the center and exam rooms built around it.
They showed us this plan, and we were all very skeptical. Everything is open, everybody can see everything. We're all worried about things like the chaos and the noise that would go on. You really, when you walk out of a room and you're a physician, you saw a patient, honestly, there's millions of things often going on in your head that you need in your head until you get done the visit and get everything in the chart. And so we were all worried that when we would come out of the room, they'd be coming in asking us this and coming in asking us that, and distraction, and we just wouldn't be able to concentrate. But amazingly, that does not happen. Everybody's doing their job. We were worried about the general noise level, but amazingly, it doesn't get noisy. We were worried about the view of the patients coming out of the room, that we would get distracted by them talking to us after they came out of the room. But one, they don't do that. The other is the in-room checkout which is another new concept we had, saved us from that too, because by the time they're leaving, you're actually already in the next room.
Hi, James. How are you?
Good, how are you?
The in-room checkout also lets patients ask the discharging nurse any sensitive follow-up questions they may have without worry that other patients can hear them.
I think it's a very good attribute to this office that the nurse comes in and goes through all the things that the doctor spoke to you about in a privacy setting.
People are much more compliant with care if it's easy. So here at this facility, we offer primary care, we offer urgent care, and then we have one specialized office area, which is cardiology. Then we also have a general lab here, so if you were sent for just some fasting blood work, or if you need to have your blood levels checked, you can have that done also.
Do you find that outcomes are improved when access to care is improved?
You do. If you make it easier, and if the doctor knows that they can send you down the hallway for whatever service it is, most likely you're going to go. Where if you have to leave and go somewhere else, there's a chance that you might not.
It's so interesting. So many people who don't have health insurance or don't have a primary care physician, we're using the emergency room.
Right.
By bringing them into the urgent care facility, how do you reduce costs, especially because that facility is shared with the primary care office?
Not every injury is an emergency, or not every illness is an emergency. Urgent care is much more like a primary care office.
I'm just going to check your eye again.
Where it is really your basic illness and injury treatment. The primary care office then does the wonderful job of taking you, the patient, the whole person, and saying, how do we take care of you so that you can be the best you can throughout your lifetime? A primary care physician, I heard this one time, and I think it's so true, it's the quarterback of the team, right? So the primary care physician knows where you need to go. They know how to make you, what the playbook is, what's best for you, and how to make you successful to win, right? So they really are the ones that know everything about you, and you really need to make sure that you have a relationship with a primary care physician, because there's going to be times in your life when things might not be going well with you physically, emotionally, your family. You need someone that you can trust and go back to, and that they can lead you in the right direction. So that's really what primary care physicians do.
Keep your head still.
We know that if we can get to you early and help you prevent disease and move towards wellness, that benefits not only the individual, but actually benefits the community. Because then the community has highly productive, highly happy, satisfied people who are working in the community to the highest of their functionality. There's always going to be a place where we're going to need acute care facilities. But if we can do our part as a health system, as part of our community, to help prevent that, then that's what we're really doing good work.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD, and follow us on Twitter at Steve Adubato.
We're at the Life After Stroke Symposium, the conference here that the Kessler Foundation has put together. A whole range of interesting people coming together, people dealing with stroke, funders of these efforts, research efforts. Life after stroke is important. The foundation is dealing with, and the chairman of the board of the foundation, Board of Trustees, Glenn Reiter, is with us. Glenn, talk to us about, first of all, your involvement in this foundation and how a private citizen like yourself got so connected and committed.
Okay, well, thank you, Steve. Thanks for being here. I've been a member of the Board of Trustees for 6 years. I've been the chairman for, I guess at this point, 6 weeks. So I'm new to the chair, but I found the Kessler mission to be very, very compelling. According to the federal government, 56 million Americans suffer from one or more physical or cognitive disabilities, and that's really a underserved population. In fact, it's a very low profile population. 56 million Americans equates to 17% of our population, and the focus of the Kessler Foundation is to serve this underserved population.
Conference like this tonight, what do you expect to come out of it?
This is a what I'd call a friend raiser, a community building exercise. We're looking to raise the profile of the Kessler Foundation. The Kessler Foundation has been doing its good works for more than a decade as a foundation. but it still is, and it has national reach and frankly international reach in terms of what it does, but we're still have a little bit of a profile issue. And so an event like this, and we expect more than 100 guests, will in some small way help to raise our profile.
And people who are dealing with stroke, how important is it that we provide their testimonials, their stories, their struggles cognitively, as well as mobility issues? How important is that?
Very important. People who have had a stroke often have difficulty in terms of reclaiming their lives, in terms of regaining independence. And so the work of the Kessler Foundation in the stroke area is directed at precisely that, to allow victims of stroke to re-engage in their communities, go back to their jobs or find new jobs that work in their situation. And so it's at the end of the day, life after stroke is about re-engagement with the victims or the patient's communities.
Well said. Thank you very much, Glenn.
Thank you.
Talking to our good friend, Dr. Karen Nolan, who is Senior Research Scientist in Human Performance and Engineering Research at Kessler Foundation. Good to see you, Doctor.
Very nice to see you again.
The people who have come here tonight, what do you think most of them are looking for? Some of them are dealing with stroke, life after stroke. What do you think most are looking for?
I think they're looking at the innovation we do at Kessler Foundation. Many of our research initiatives have started with donations and support from patients, family members, volunteers, somebody who's had a connection to the hospital or someone who has a connection to the disease. And many of our research initiatives have started from that kind of a donation. And I think they're looking to get involved to help.
Your area of expertise, let's break it down. You deal with motor function, motor rehabilitation, and biomechanics. And there's a robotic skeleton. What is the technical name?
So my background is in biomechanics, which is the physics of human movement. And so what we're doing is looking how the bones and the muscles move, looking at how the muscles contract, looking at how the limb segments move. And the goal of the exoskeleton is to take...
Say it again, what it's called, the exoskeleton.
Exoskeleton.
Exo.
Yeah, exoskeleton. And the goal of it is to provide a rigid framework around the human body that helps you move. So in traditional physical therapy, you would have the physical therapist manually moving the body. So they manually lift the leg, they manually move the arm. They do a lot of manual tasks and actually help the patient sequence through relearning movements they've lost from brain injury or stroke. So the exoskeleton is a powered, motorized device that in this case is helping you regain the ability to walk. And so it's walking for you under the guidance of a physical therapist. So it has motors at the hip, motors at the knee, and it provides support to the outside of the body to help move the limbs and take a step in a balanced and symmetrical fashion. And it's helping relearn the ability to walk. So when we walk, right, we have weight shifts. So we have to shift our weight and we have to offload or lift a limb and take a step. So what the device is doing through motors is helping you take that next step, and it's cueing you to shift your weight to walk in a synchronized and symmetrical fashion.
Talk about the quality of life issues associated with this. What does it do for people in terms of their quality of life?
So the goal in rehabilitation with our knowledge of neuroplasticity is get someone up and walking, get dosing really high, get as many steps as possible. But a lot of times with the guidance and manual assistance from a physical therapist, that dosing is high, but the quality may not be as possible because physically the therapist is moving the patient. And so what we want is we want the exoskeleton to provide high dosage and good quality walking to help retrain a healthy walking pattern while their brain is healing and learning after stroke.
The economics of this, talk about it.
So currently we have 3 exoskeletons that we can use at Kessler Institute for Rehabilitation West Orange and Kessler Institute Saddlebrook. Both of those are provided by Kessler Foundation. So they were provided through donations as well as support from the foundation. So the foundation purchased these devices, implemented into the clinical setting at Kessler Institute for Rehabilitation to use immediately with inpatients. And so what we're doing is we've implemented these devices. We're looking at the safety, feasibility, and efficacy of these devices. So economically, we're providing this as a research study. So we're looking at this from a research perspective, but it's translational research because we're implementing it immediately into the clinical setting. And we're trying to see, is it feasible? Can it be done in a clinical block of time? And how does it change the research, the rehabilitation landscape? How does it change recovery? And can we maximize recovery by using a device like this?
Who else is doing this research?
There are other centers around the U.S. doing this research. However, we are very cutting edge in that we're applying it in the acute inpatient process.
Why is that important?
Because it's where the brain is healing and relearning. It's where they're learning to walk again. And so when they're relearning the ability to walk, many times in the chronic phase, you're trying to unlearn bad habits or unlearn asymmetrical patterns. What we want to do is train with the best quality and the highest dosage as early as possible in the rehabilitation process so that they're constantly learning in an environment that's good quality and relearning their patterns in a very healthy way. And we want to maximize recovery.
Final question. You're very optimistic about life after stroke and what's possible, aren't you? You've seen a lot.
I'm really optimistic because when we first started, the knowledge of neuroplasticity was in its infancy, and it's still growing tremendously. And the idea that someone could continue to recover 6 months post-stroke and have maximum recovery in the first 3 months post-stroke, we have many techniques, many technology, many new strategies that can really maximize recovery that we didn't used to have. And with the new age of technology and applying it right into the inpatient setting, we can really set someone up to have a better recovery long term.
Thank you, Doc.
Thank you very much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Choose New Jersey, Gary's Wine and Marketplace, New Jersey Resources, MD Advantage, the Give Something Back Foundation, NJM, and by the New Jersey Office of the Insurance Fraud Prosecutor. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
At Gary's Wine and Marketplace, planning parties is our business. Our associates can work with you to plan the details. We offer an assortment of wine, beer, spirits, cheeses, party platters, accessories, and more. 4 locations in New Jersey and at garyswine.com.